Hello. This is Sudarshan, and in this episode PH 1.28, we will talk about anti-anginal drugs, the drugs to treat angina pectoris. So, coming to the different class of drugs which we can expect. So, first being nitrates, then beta blockers, then calcium channel blockers, then K plus openers, and other drugs. So, coming to nitrates. Let us see. So we have nitroglycerin, then isosorbide dinitrate and mononitrate, then erythritol tetranitrate and pentaerythritol tetranitrate. And then we have beta blockers, that too the non-selective beta blockers like propranolol, timolol, nadolol, pindolol, sotalol, bisoprolol, metoprolol, and calcium channel blockers, that is the dihydropyridines and non-dihydropyridines. Non-dihydropyridines like verapamil and diltiazem, and dihydropyridines that end with dipine suffix like nifedipine, amlodipine, felodipine, clindipine, lercanidipine, lacidipine, nimodipine. And then we have K plus openers like nicorandil and other drugs. For that there is a mnemonic STAIR, S-T-A-I-R. S for statins, T for trimetazidine, A for antiplatelet drugs, I for ivabradine, and R for ranolazine. So let us start with nitrates. As I said, the drugs in this class: nitroglycerin, also called glyceryl trinitrate, then isosorbide dinitrate, then isosorbide mononitrate, then erythritol tetranitrate and pentaerythritol tetranitrate. So very common mechanism of action which we can expect. So basically the nitrates will release nitric oxide that increases cyclic GMP in the smooth muscle, and that activates MLCK or myosin light chain kinase. So kinase is causing phosphorylation. It doesn't allow phosphorylation of the vascular smooth muscle. Because of that, vasodilators. So these drugs are also called as cyclic GMP mediated vasodilators. And what about the pharmacological action? So mainly it causes three things: venodilatation, arteriolar dilatation, and dilatation of the coronary and collateral vessels. So with venodilatation, it mainly causes preload. With arteriolar dilatation, it causes A for afterload. But very commonly, they will reduce the cardiac output and oxygen demand of the myocardium, and also they will cause blood pooling with decreased venous return in the heart. Yes, and that is the main action. And with the uses, obviously to treat angina, different kinds like stable, unstable, and Prinzmetal angina, other cardiac conditions like MI, congestive heart failure, hypertensive urgency, then biliary colic, and a very important use, cyanide poisoning. So let us discuss about it. So cyanide poisoning, this is a condition where the cyanide will inhibit the cytochrome C oxidase of ETC, that is the complex 4 of ETC, and we know that ETC generates oxygen, and because of cyanides it is going to block it, so the patient goes into anaerobic respiration. Alright, so that was with the mechanism of action. And with respect to the side effects, so very commonly it is seen in industrial exposure. And with the side effects, mainly it causes skin changes, then cherry red spots on macula, almond breath and taste, confusion, cardiac arrhythmias, cardiotoxicity, etc. And with respect to the treatment of the cyanide poisoning, first the diagnosis, mainly on labs, we are going to see lactic acidosis, increased partial pressure of venous oxygen. Apart from that, the assessment of carboxy and methemoglobin levels. So treatment, there would be two lines of treatment. First line of treatment is sodium thiosulfate and sodium thiosulfate and sodium nitrite. And the second line of treatment is hydroxycobalamin. Hydroxycobalamin is generally preferred. Right. So, and apart from that, with respect to nitroglycerin, there are some points to remember. Very importantly, nitroglycerin causes Monday disease. So Monday disease is a condition very commonly seen in industrial workers who have more tolerance on the weekdays and less tolerance in the weekends. And the symptoms which are seen is flushing, reflex tachycardia, hypotension, headache. And nitroglycerin should never be combined with phosphodiesterase 5 inhibitors ending with FIL-FIL, sildenafil, tadalafil and vardenafil to treat erectile dysfunction because it can cause dangerous drop in blood pressure. Sildenafil trade name is Viagra. And also nitrates are used to treat pulmonary embolism. Right, so the nitrates is the very important class in angina. And apart from that, as I told, beta blockers, calcium channel blockers, and yes, let us see with K plus openers, Nicorandil. As the name itself tells the mechanism of action, that is, it allows all the K plus to come out of the cell. Because of that, vasodilatation is occurring, and then hyperpolarization, where more charges will be there on the cell membrane. That reduces the cardiac output mainly. And side effects mainly GI distress, headache, hypotension, palpitation, all that. And in the other drugs, mainly we have this ivabradine, trimetazidine and ranolazine. Very commonly they are inhibitors of beta oxidation or fatty acid oxidation. And that reduces the oxygen demand and the cardiac output. And mainly they are combined with other anti-anginals like nitrates. Right. And yes, and with the drug interactions of this class of drugs, mainly nitrates will interact with beta blockers and calcium channel blockers, which are also like beta blockers is class 2 antiarrhythmics and class 4 antiarrhythmics like verapamil and diltiazem. And also calcium channel blockers will interact with beta blockers in return. So mainly what happens is there will be a reduced heart rate, cardiac output, there will be vasodilatation, reflex tachycardia, but main thing is that coronary blood flow is going to improve. So that is all with the anti-anginal drugs. So thank you so much. We'll see you in the next lesson.